One of the big outputs of the Games for Health project is the Games for Health conference, and it's amazing. I mean, you're talking about close to 300 or more people over 2 days, going to 20 to 40 sessions, and just getting to know each other, getting to see things that they had never seen before. And that's what's great. The Games for Health conference is the opportunity for us to see, as a community, where our story is and what's going on. And so far, each year it's gotten bigger and better, and the story's gotten richer. Game developers, designers, people who work in this industry are very fast. They adapt and understand problems and people's ideas very, very quickly. And so you get this just great immediate set of activities. And then our job is to make those initially happen, and then to foster them and hopefully grow them so that they actually turn into real output, which we're really proud to say that we have instances and stories from the Games for Health project where we know we've done that. We literally got two people to meet for the first time, and we find out 6 months, a year later, that they've actually been collaborating for that past amount of time. And then the great thing is then we bring them back almost as alumni to speak and show what their collaborations were.
So this is the GlucoBoy. It's a blood glucose meter. So this device itself right now is a fully functioning meter. You can test your blood with it. We have a Nintendo Game Boy here, and it slides in. And what happens is when a user tests their blood sugars, that data is saved and converted to points that they will be able to use in the video game. It actually gets stored as currency that they can use maybe to unlock a level, to bring out a new character, to get a new weapon. And we've also got a USB port on the side so that we can connect it to a computer, and it'll automatically take you to the web community for the device. We have a flashing alert LED that we can use to send messages or let people know when there's a message waiting, let people know when they need to update their records online. And so it's incentivizing the testing of the blood sugars, which is very difficult. Our target audience is about 6 to 12-year-old, male and female, and convincing them that they have to test their bloods by poking themselves and then give themselves an injection 4 or 5 times a day is a big task.
A physiology engine is a mathematical model. It's a system of systems, just like a flight simulation, to model the things that happen in the body in terms of heart rate, heat transfer, fluid transfer, those types of things. And then as an extension of that, some physiology models also have a pharmacokinetic component so that you can administer drugs and see the reactions that the virtual standardized patient has to those interventions.
Report of a severe earthquake, major structural damage, multiple calls.
Let's choose our equipment.
Oh, my leg. I think it's broken.
My head.
At Virtual Heroes, we make a distinction between straight simulations and serious games. We think that serious games have infinite replayability and the opportunity for players to test, explore, and learn from their environment, whether it's in a single player mode or in a mode with other people where they're learning collectively at the same time. We think that these opportunities that we're now undertaking are opportunities that are fun, that are immersive, that draw people in because they want to be training in these scenarios and provide a means to learn in a way that's unprecedented. I think that games are the wave of the future. We have the net generation that's in school now. We say at our company, Virtual Heroes, that if you're 35 or younger, you've pretty much grown up with games on one platform or another. And so those folks are chief learning officers. They're running hospitals, institutions, the military. And basically by using games, we can leverage state-of-the-art technologies in a way that's distributed, in a way that people are familiar with, in a way where they can reach out and see best practices from around the world. The technology is ready. I also think that for the first time, the market is ready. We've been doing this work for several years now, and at some point in the past, we felt like a lone voice in the wilderness. But it's very exciting for us to see esteemed institutions like the Duke University Medical School, healthcare providers, and others embracing the use of essentially game technology to accelerate learning, increase retention, and help young people to be more proficient in the critical skills that they have to have.
For the Games for Health project, one of the things we want to be able to do is not just look forward, but to look back and be able to point at elements that have happened, at projects that have launched, at collaborations that have worked out, and say there are specific things that are making us healthier, or making health professionals better, or making the entire health system a more pleasurable and successful experience because of the work we did to bring in game developers, game technologies, games themselves, and the researchers and other people who will make games play a really great contribution in improving health and healthcare.